You can see here this very round protuberant shape of the abdomen requires surgical correction. No exercise in the world is going to fix this, but it can be surgically corrected in a tummy tuck procedure, and you can see how well it flattens it out by repairing the space between the rectus muscles. So following pregnancy, many women experience something called diastasis recti. This is a schematic representative of exactly what is happening during that process. The growing fetus expands the abdominal wall, as we all know. Normally, the vertically oriented rectus muscles sit right together in the midline. Varying degrees of diastasis can occur following childbearing. Obviously, the bigger the child, the greater the risk that they will expand. Twins, even more so. But some women will experience severe diastasis even with a single childbirth. And it just depends on the elasticity and strength of the connective tissue for any individual person, and much of that is controlled by genetics. This is a very mild diastasis. You can see the gap between the rectus muscles is relatively narrow. Nevertheless, that can show and give the abdominal wall more protuberance forward and can be disconcerting. And unfortunately, this isn't something that can be improved with exercise. The space between the muscles is composed of a tissue called fascia. Fascia is inelastic, it's rigid, and it does not respond to strengthening in any way. Here's another example of a much more severe case where the gap is quite wide, and this can be very disconcerting for women who experience this, because they often will look pregnant. They will look 5, 6, 8 months pregnant, and they're not. And they will get asked, how far along are you? And they're not pregnant. They have a very, very severe separation between the rectus muscles of this fascia. That fascia gets thin and stretched out. And the only correction for it is a surgical one, unfortunately. This is a more severe case of separation. This looks like maybe a 4-month pregnancy, 3 or 4 month pregnancy. You see that protuberance can be repaired. Abdominal exercises, crunches, sit-ups and such, they become less effective because the muscles, because they're separated, don't engage the same way as they do when the muscles are back together. So core strength is weakened, dramatically weakened. In some women, they will feel that even low back pain is caused by weakness of the abdominal wall, and I've seen many patients who felt like their low back pain improved with diastasis repair. One of the most severe ones that I've taken care of is this nice lady who looks 6, 7 months pregnant, and she's not. Again, she has an umbilical hernia, which more times than not, it is present when they have a severe diastasis like this, can be repaired, and a major dramatic improvement achieved. Of course, there is loose skin as well, but the primary issue in this patient is that very, very weak abdominal wall, the separation between the rectus muscles. So it's a rewarding experience to repair this because it can create a very dramatic change. That's my comments for diastasis, and if you have questions, feel free to contact us. Be more than happy to answer them. Thank you so much.